right, so Jackie, why don't you and Amber take it away first? Y'all introduce yourself. Go for it.
All right. Hi, everyone. My name is Jackie Gregory. I'm the Child Find and Outreach Coordinator for Any Baby Can's Early Childhood Intervention Program. It's a very long name. And my colleague Amber will go ahead and introduce herself too.
Hi, I'm Amber Jensen, and I manage outreach for Hayes County for Any Baby Can ECI. And I know we have a couple of our direct care staff here today also. We have one of our early intervention specialists here, Melissa Hughes, and hi, Melissa, and our occupational therapist, Carrie Webb, is here as well.
Hi, guys.
Hi, Carrie.
Awesome. Okay, and then from our Caldwell County ECI program, Tanaya, do you want to go ahead and introduce yourself to the folks?
Hi, my name is Tanaya Martin. I'm with Bluebonnet Trails Community Services Early Intervention Program. I am the Child Find and Outreach Coordinator as well. I'm an Early Intervention Specialist. I'm a Service Coordinator as well. I am Caldwell County, the outreach for them, but also Williamson County, Fayette County, Vernon County as well. We service those areas.
Awesome. All right, and then our star pediatrician, Dr. Harrison, go ahead and introduce yourself.
I'm Sue Ann Harrison. I'm a pediatrician with Corridor Primary Care. I've been practicing pediatrics in San Marcos for 33 years, and we have offices both in San Marcos and in Kyle.
Fantastic. So I am going to let Jackie do a screen share right now and give us all a bit of an overview of the ECI program in the state of Texas. This will cover both what Tanaya's program does out in Caldwell County and all the other counties they serve, as well as what Any Baby Can does across the communities they serve. This is kind of the general deal for the entire state of Texas. So take it away, Jackie.
All right. Everybody see the curtains opening? We're good? Okay. I'm usually out seeing all of you in person and not doing this Zoom thing, so I'm not as technically savvy as many of you may be, but here we go. So Early Childhood Intervention is a statewide program under the Texas Health and Human Services Commission. This can get to be very lengthy, this presentation, so I'm going to be quick about it, just like Alex did, but please reach out to myself or Amber if you would like for us to give you this presentation in more depth, and we can kind of go through it a little more with some of your questions. We're going to talk a lot about this today anyways, but I'm going to breeze through it, okay? So we are a statewide program under Texas Health and Human Services Commission. We serve little ones 0 to 3 who have a developmental delay, disability, medical diagnosis that could impact their development, including hearing loss or vision loss. Some of the little tidbits: we provide developmental evaluations at no cost to families, no out-of-pocket cost to families, and we typically provide services in the natural environment, in their home. At this time, we are in the Zoom world, so we are providing all of our services virtually just to keep everybody safe at this time. So we are authorized by by IDEA. We are Part C of that program. We can get into that a little more later because it can get a little confusing with all of that. But Part C recognizes the need to reach very small children with disabilities. So this is a really good flow chart that just kind of shows how we function. So ECI has rules from the feds, we have rules from the state, and all of the programs across the state of Texas follow those same rules. Things may look a little bit different program-wise, just depending on what host agency we are in. So you may see a different name. For example, right, we have Bluebonnet Trails on the call today. We are with Any Baby Can. So ECI programs are housed in a host agency. And so sometimes we have agency policies that we need to follow through with as well. And then we have our team members who are providing those direct services. So we have a couple of those on the call today, which is really nice. So this is a lot of words on the screen right now, right? Typically don't like a busy slide like this, but this is an important thing to know because there is a rule that states, it's a federal and a state rule that states once a child is identified with a developmental delay, the healthcare professional has 7 days to refer them to an ECI program. Now, we don't have to be the only option for those families, but we are required to be one of them. And this is just to make sure that we're identifying those little ones, that we are able to reach them and provide resources for them to do a developmental test to see if they need some assistance from our program. So I feel like this is an important thing for everybody to know about and to see. It's a federal rule. I'm happy to give you a copy of it so you can know about it. But this is why it's also important that we have good relationships with our partners like Dr. Harrison, and we are able to reach these little ones. Okay. This is all about funding, right? So we do receive federal funding, state funding, but that accounts for less than half of what we need to stay afloat. So we do rely on faith-based organizations. We rely on our medical reimbursement. We rely on a lot of these other things just to help us stay afloat to be able to provide these services. The most important thing to remember is that we will never turn away a child due to inability to pay for services. Our goal is to identify these little ones, to reach them, and to provide services to help them. And Alex said a lot about the importance of brain development during 0 to 3. And so this is a huge part of why we're here and why we're doing this work, right? So our approach is a little different than other organizations. We work directly with the family. Some providers may provide one-on-one service with that child, but we work with the parents, with the grandparents, with the child care provider to make sure that everybody is involved in that child's development and care. I'm breezing through this, guys, getting through it really fast for Alex here. So the first step, of course, for our program is referral. Anybody can make a referral to ECI. We get referrals from our providers, of course, our healthcare providers, because we have a really great relationship with them. We have great relationships with a lot of our other daycare centers with CPS, but a parent can make a referral to our program. Anybody, any family member, anybody can make a referral to our program. So that's the first step. And then our team will reach out to that family to schedule an evaluation to see if that child is eligible for ECI services. Okay. So this is our eligibility criteria to determine if a child is eligible for ECI, right? So we have one of the eligibility criteria is if they would qualify under a qualifying medical diagnosis. Now, the state has compiled a very long list of diagnoses that have been shown to have an impact on development, right? Examples of this is cerebral palsy or autism. Some of those are auto qualifiers for our program, but a child still needs to show a need for services in order to be able to qualify for us, okay? And that could just be a case management need because we see that a lot of our families are needing help accessing resources. And so those kiddos can automatically qualify for our program if they have that need. We are also kind of the gatekeepers in order for little ones who have hearing or vision loss to receive services from their local education agency. So that's just another way to say their ISD, right? Their local ISD. I think Shelly Cervinka is on the call today too, and she is our liaison with Hayes. And so we have a good relationship with them as well to make sure our kiddos are getting services for their deaf or hard of hearing needs or vision needs. And then the third way is under developmental delay. Now, ECI has a very structured test called the Battelle Developmental Inventory. All of the programs in the state of Texas are required to complete this test on kiddos to qualify under developmental delay. It has a kit, it tells you exactly what you need to do. And so in order for a kiddo to qualify under developmental delay, they must show that 25% delay in any of the developmental areas. With the exception of expressive communication. If a child is only showing a delay in expressive communication, then they'll need to show a 33% delay. And of course, these are all statewide rules and regulations that we are all following, right? Okay, breezing through. So once a kiddo is identified, or once a kiddo is deemed eligible for services, then we will complete an IFSP meeting. Many of you may be familiar with this term. Basically, it's that kiddo's plan of service, right? And so a team will be established for that little one. We are, of course, a voluntary program, and so we want to make sure that families understand their rights, and we go through all of that with them. You're going to see some timeline dates on here because we have to follow through with some of those things based on state regs and all of our rules and regs that we follow. But you'll just kind of see, this is kind of how ECI evolves, right? A kiddo is deemed eligible. We develop a plan for them based on their need. We start service delivery within 28 days. And then we continue to monitor that kiddo's progress. Now, I think it's important to note that if for some reason a kiddo does not qualify for ECI services, we are going to help to direct them in the right place, right? We want to make sure that they're not just left high and dry. If they still need some sort of support or services, our team is going to offer resources for them to do that, okay? Okay. These are some of our team members in ECI, although we really need an updated picture because we have had some changes and we have grown. Our team is now huge. But these are some of the people that will work in ECI on a kiddo's case. Every case will have a case manager, a dedicated case manager who is going to really work with that family to determine what chapter they're in for their kiddo services, where they need to go, if they need help accessing insurance or whatever that may be. We have early intervention specialists. ECI has a very unique and special service called specialized skills training. And early intervention specialists complete this service, and it's really awesome. I really like to explain the service as being a kiddo's personal developmental coach. So EIS is really going and work on tying in cognition and social emotional and working with the team to make sure that every area of development is being monitored for that little one. We also have speech therapists, occupational therapists, PTs. We work collaboratively with our DHH and VI teachers, deaf or hard of hearing teachers, or vision impairment teachers, and anybody else who is involved in that kiddo's care. If that kiddo has a nurse, private nursing, or if they are receiving private therapy, we're going to work with them as well. And then we also are going to help our kiddos transition out of ECI when they turn 3, because when they turn 3, they are no longer eligible for our services. And so their ECI chapter has ended, and we're going to make sure that they're connected to the next chapter of their services, if that's through special education, through their local school district, private therapy, whatever that may be. ECI is there to support them in that. And I think that is the fastest I have ever gone through this. So there are different ways that you can refer to ECI. We have a local ECI referral form for our healthcare professionals, our pediatricians. They have their own special referral form that they can use. I'm happy to share those with you. You could also contact your ECI program. You could contact me, anybody, and we are happy to take that referral for you in ECI, okay? It's kind of stressful going through this so fast because you feel like you're missing so many things.
You nailed it. It was awesome.
Let me know if you have questions.
Yeah, there are a couple of questions in the chat. Not all, so I think some of them actually were from the data I shared. So Miss Gwen asked about, which maybe Dr. Harrison can help with this. I'm just a sharer of data. Can anyone speak to why the percentage of children receiving a developmental screening in the first 3 years is lower than the percentage of children receiving at least 6 well-child checks in the first 15 months?
Well, I think one of those reasons is not everyone goes to a pediatrician to get those well checks. I think pediatricians are pretty good about doing those developmental screens. I know our group is. We do it on all our well checks. Texas Health Step children, which is a particular group of children that are on Medicaid or STAR plans. In order to get reimbursed for those, you are required to do it. We do it on all of our children that come in. But if you're not going to a pediatrician, so often they don't do those developmental screens. And I think a lot of the children don't get those because of that. And I would suspect that that's the major reason. I don't know if anyone else has input on that or not.
Yeah, that makes a ton of sense. You're right. I mean, that's really what pediatricians bring to the work that's so special, is it's that expertise in child development and medicine that's kind of unique. And I think the other thing, I know this has come up for me personally, so this is when we get to personal anecdote time from Alex, having had 4 kids. Sometimes you show up for your well child check and they're like, oh, they're sick. So doing a developmental screener today is probably not a great idea, because we're not going to do very well because we have 103 fever and a ear infection. And like, this is now a sick child visit because we need antibiotics and we need all these other things. It becomes a different thing. And I know I'm not the only parent who has done that. Other folks have done that too, where you show up and you're like, oh, we're sick today.
And that's true. And you may miss your well child checkup, and then you come in the next time and it's like, well, we need to catch up on your immunizations, and you get caught up on those and you miss that checkup. That's probably not the majority of them, but that is another reason.
Yeah. Okay, awesome. Thank you for clarifying that. And then Di had a question, and this is probably for you, Jackie, or anybody from ECI. Can childcare providers refer to ECI?
Yes, 100%. Absolutely. We have a lot of good relationships with our local daycares too that we work with. Amber, do you want to say something?
Yeah, I'm sorry. Alex, I think maybe, and I'm not sure if this is right, but if they were talking about, I see in the chat, the federal rule that they're required to refer to ECI.
That's what that question was.
I'm not sure if Jackie, you may know better than me, but will that federal rule apply to childcare providers as well as pediatricians?
No, that rule is specifically for our healthcare professionals and,
Okay.
and our doctors, pediatricians, and that field. Yeah.
I actually learned from that myself. I didn't know we were required to. I mean, we do, but I didn't know it was a requirement. I think that's something that other physicians need to know as well.
Absolutely. And that's something that we really Amber and I try to get out there and inform providers, because we understand that that there are some providers who just aren't aware of that. We have just to add on to that, we actually have a partnership with Dell residents. And so we have residents coming about once a week at this point to come and observe ECI services so that they can become familiar with the process and understand what they are meant to do whenever they are out in the field on their own.
Right. Yeah, that is a really, really good point. Nurse Sandy with our Nurse Family Partnership Program, which is part of Any Baby Can that serves Hayes County, also wanted to kind of share information. It's in the chat about what NFP does, which is unique. They are registered nurses, and they also do developmental assessments, but then oftentimes could be referring to ECI as well. So there's information there. And another question, frequently our referrals are linked to behavior shown in a classroom. How is ECI assessing children in their typical classroom environment?
I want to invite one of my team members to answer that question. Carrie, Melissa, you guys are doing evals out in the field. Do you have something to contribute to that?
Melissa, I think. There, okay.
Okay. Well, I'll try. I'd love to tell you we're assessing children in their classrooms right now, but we have not been in the classroom setting in quite a while. But before all of this hit, we were able to go into the childcare setting and actually do those evaluations in the classroom, which gave us the ability to observe those children, which is a huge part of our evaluation process, that observation piece, and also gave the teachers an opportunity to share their input as well.
Yeah, and then I think her question also had something to do with kind of the timing, probably some of those guidelines that y'all have around how quickly you have to assess and kind of create a plan and whatnot. But if you're able to get into those childcare settings, you could do it presumably within that time frame.
We absolutely have to do it within the time frame. Whether we do it in the classroom or at home, we have the same guidelines that we have to have the whole process completed within 45 days of the referral.
Okay, Stacy with WIC wanted to know, what are some of the most common reasons that kiddos get referred to ECI? Anybody with ACI can take it. Take it away.
Just miss a lot of times. We have they're missing their milestones. You know, I believe that's probably frequently. Especially if they're in if they're in a daycare setting, or if they're going to their pediatrician maybe a couple times. The parents may be concerned that they're not doing what some of their cousins, they've been to their, around family, especially around the holidays. We're probably going to get, a spike in referrals because they're around their family and they're like, oh, little Susie is not developing like her other little cousin. So yeah, so just missing milestones. I think.
Is there one kind of area where you feel like most of those, or maybe there's one area that parents notice or providers notice first, and then it becomes like, oh yes, and also kind of these other delays, or is it kind of a little bit of everything?
We mostly get our, I mean, most of our referrals are communication. I mean, the kids aren't talking at a certain age.
I would say as a pediatrician, that's primarily what we see first, is speech delays.
Yeah,
Right.
Speech delays. So yeah, I mean, I don't know about, I'm assuming everybody else, but I'm not sure. For our program.
We get a lot of speech too. We get gross motor, and also because we are kind of those gatekeepers in order for kiddos to receive deaf or hard of hearing services or vision services from the school district. We get a lot of referrals from audiologists that note a child's hearing delay, or from the eye doctor that shows that a kiddo has needs in that area. So yeah.
That makes sense. Well, and you think too about kind of those biggest milestones as a parent that you're waiting for, like first words and first steps. And if we miss those, and cousins and other kids in the childcare environment are doing those things, then it becomes very kind of apparent all of a sudden, right? For those folks. Okay, let me see here. Oh, some great questions, y'all. I probably won't even need to ask my own questions. I love that. Di also wanted to know, with y'all not being allowed to go into those childcare settings right now, how are we working around that issue?
I don't know if one of our direct care staff want to answer that.
So what we are seeing right now is that the Head Start programs are opening back up, the early Head Start. So what we're trying to do with families is either see them before they go in or in the evenings. I wish I had more information for you, but we will see how that works, because a lot of the kiddos are really tired by 4:35. So it's kind of up in the air for us as well. Head Start, I guess, is allowing people in, but the private daycares are not. So it'll be interesting to see what happens.
Right. And kind of on that same vein, questions about your overall referrals for ECI are down kind of year over year at this time. Presumably because you have families who are maybe keeping kiddos home instead of sending them to childcare. Would you say that's, mostly accurate?
And I think for Any Baby Can, I don't know how Caldwell is doing, but I think we're still getting a fair amount of referrals, kids that are still going to the pediatrician, getting their well checks, but we are having a higher percentage of little ones that maybe the parents are choosing to defer services because they're wanting to wait until the kids can be seen in their daycare, or things can go back to normal if they're refusing telehealth services.
Gotcha.
And some parents are all on board with it and it's good, but I do think a larger number of our referrals are opting to wait and not do telehealth services.
Right. This is another question specifically from a childcare partner, that ECI used to come to their center and do screenings. Could that still be done when we get into a kind of when we get on the other side of this COVID situation? Do we have the opportunity, did ECI providers, could they come to the center? And I guess with parent consent, spoiler alert, I actually my children went to this particular childcare and I had them screened by ECI at the time they were there because they were twins and I was worried. So I know that used to kind of be the process of a parent just kind of had to say like, yes, ECI can come in and take a look kind of thing.
Yes, absolutely. That's definitely something that, we're Bluebonnet in the works to do. We're trying to develop. So as soon as we're allowed there, we are definitely going to go in there and start doing screenings for those little ones. I actually have been I think sometimes we're missing the in-home daycare providers too. And so I've been on a couple like Zoom calls with like the Williamson County Association for In-Home Care. And so I've just been trying to give them a little bit knowledge about, what ECI is and, kind of give them an idea of what to look for. And then we're planning on doing some screenings at their in-home, their in-home places when we can as well.
Alex, it's Tina.
Hey.
Hey, it's Tina from First Step.
Yeah.
Okay, I just want to make sure my question was understood because it wasn't just upon a parent referral. We used to have every child in our school, we got a consent, like you were saying that you signed it, that would come into they would come in and screen, and every child, whether there was a problem or we felt that there was a problem or not, any child under 3, and then if there were any problems or any concerns from ECI, then they would talk to the parent and then they would get services.
Gotcha.
So I wanted to make sure my question was clear about that.
It was clear, yes.
I was under the impression that they don't do that anymore.
I don't know about Caldwell, but I know for us at Any Baby Can, we haven't been doing, it's not kind of common practice for us anymore to do just general developmental screenings across the board. I don't know, Jackie can share any more information that she has, but I know that that's not something that right at this second, something that even under normal circumstances that we would participate in. We just don't generally do that anymore.
I see Carrie has unmuted, so I'll let her.
Yeah. Hey, Tina, this is Carrie, the OT. Hi.
Yes, ma'am. Hi, I miss you.
So, I know what Tina's talking about. So I think when we were doing the screenings, Amber, that was back when we were part of Hill Country. And I think that stopped when we switched over to Any Baby Can because of their rules and regulations.
Got you. Okay. And just to let you guys know, we can still have you come in. CDC and Rising's minimum standards does say that therapists can come in and work with the children in-house. We just have to check your temperature and do a health check.
That's good to know. Thank you. I know for Any Baby Can ECI, currently we are still all working virtually until December at the time being. So I guess we're all just kind of navigating. I know Carrie's sad face. We're all just kind of navigating this as we go. So, but that's really great to know in the future. And in terms of coming to centers to do screenings, that's definitely something that has been on our radar to start doing for a while, that we've been talking with our directors about. So hopefully we can start doing that again after all of this nonsense is over, all the scary stuff. We get to go back to normal, right?
Right. Nurse Sandra had a question about referrals from NICU and or well baby nurseries due to preterm births. Is ECI getting referrals from the NICU team for, yes, I'm seeing a lot of nodding.
Yes.
So yes, the answers are resounding yes. We're getting those referrals too. Perfect. Do you think that families could be opting to wait or defer services because of lack of technology access for the family, i.e. if they're going to be doing a Zoom telehealth thing and maybe the family doesn't have that level of technology?
I don't know how Caldwell is doing it, but I know for us at Any Baby Can, we've really made an effort to ensure that those families have technology, whether it's, maybe providing them with some kind of phone so that they can access Zoom. So I don't know if it's necessarily access to technology, or I really am not sure why. I mean, I know our scheduler, she does explain the telehealth process to them.
Can I comment on some of that?
Yeah.
Yeah.
Talking to parents who have experienced some therapies, not just with ECI, but with private things that have gone through some of that, they have just become frustrated after doing it for a while that they don't feel like their children are progressing. And not only that, but talking to the therapists that I've talked to, they have a hard time connecting through this kind of media with the small kids. Their attention span is so short.
Absolutely. And hi, also adult attention spans are short on
Yeah.
digital,
Yeah.
on the virtual platform. It is hard to, I would say, to start a relationship virtually. If you have a relationship established with this person and the child, even on a screen, the child is like, oh, that's my person. I recognize them. I'm so happy to see them. That's going to be a very different experience than like being brand new and having to build relationship virtually. That is super, super challenging. Okay. Another comment question, wondering if parents aren't opting to partake in well child checks, seeing a decline in demand for services, and if there's a missing link there in education for families about milestones, right? So if we're relying too heavily, maybe I'm in tuning because I know this person who wrote this question, that there's a missing link there between, you know, what a pediatric practitioner can do in the few minutes that they have with the family, and that we are the rest of the community needs to play a role in ensuring that families know kind of what normal child development is.
I have been surprised that for the most part, with my new moms and dads and younger children, I have not had a problem getting them to come back in for their well child checkups. For the most part, I do find that when they don't have immunizations involved for those checkups, that they're not as likely to come in. But for the most part, I think we're having, at least our group is having a pretty good response to well checkups. At first there was hesitation, but as the pandemic and the isolation has gone on and on and on, it's been much better.
Yeah. Okay. Keep going down to these other questions. Yep. And appreciations for providers. I love that. Okay. So I'm going to jump into some of my questions. That doesn't mean I'm going to ignore the chat. So everybody who's on here today, feel free to continue putting questions into the chat. I did want to take a little bit of time to hear from our ECI folks and then from Dr. Harrison about kind of the biggest things that have changed since March, so since COVID. What have been the biggest changes in your service provision in this time frame?
So I could throw that one out there. We are trying to limit the number of people that come in during an exam. For instance, if all possible, we try to limit it to one parent at a time coming in, or one parent rather than a parent and a grandparent. There are circumstances where we do allow that, which I don't think is always the best circumstances, but we do try to limit the number at a time. We've changed some of the ways in which we're doing screening. And we didn't like to do, we've changed the way we did Denver developmental screens for a long time, which I've been a proponent on because I can watch the children hands-on rather than just do a questionnaire. And I still prefer that, and not all of my providers agree with me. And we've changed to another screening test, which is a questionnaire for parents to answer. Just because the kids don't get to play with toys. We don't have as much sanitation to do. We did a program, and we still do it, but it's more limited, a Reach Out and Read program where we handed out books to kids and we got to watch them interact with that. We don't get as many books as we did, but we've limited that to a certain extent because we're just trying to keep down the sanitation in the office. So I would say those are the major things that we have changed as far as what we're doing with development and our interaction during well checkups.
Yeah, all of that makes a ton of sense. And no waiting room. That's the other big thing.
And no waiting room. That's a big thing. And I'm not sure how we're going to approach that in the future. So many of our patients like that. they sit in their cars and we call them in and out at one at a time. We have cut down on our volume a great deal because of the way our office flows right now. Changed a great deal. So yeah, those are big changes. We did our flu clinic this year, which we've always had in the past, and we still did. We did a drive-through in the parking lot, and
you got some kudos for that in the chat. People are talking about your drive-through flu shots, and everybody's giving you lots of positive feedback on that. So
you know, we have had to. We're doing a lot of COVID testing since school started, and we've had to. So it takes a lot more time when you have to change your uniform through the day and do all those sanitation things. Well, I mean, we act as though everybody has COVID, so we're all doing our N95s and sanitizing our rooms just like we were doing when they're not. But it takes a lot more time to do that kind of transfer through the day. So.
right. Anybody from ECI want to talk? I mean, obviously telehealth, but you share maybe a little bit about what that looks like.
Amber, Jackie? Amber?
Yeah, I think maybe one of our providers could give us, our direct providers could give us a little more information on kind of how telehealth looks for them right now. They can answer better than me.
I can start by just saying that as of March, of course, everything has been moved to virtual, right? So we initially were going to do a, what's the word I'm looking for? When you start something, new mom brain here, a pilot. We're going to do a pilot program for telehealth, but because of COVID, we just went right into it. And our team just did an excellent and amazing job at just kind of pivoting, right? That's the word for right now, pivoting and figuring out how to make that work. So all of our evaluations have been done over the Zoom platform. We've been using DocuSign and all of these other methods to get our signatures, our consents completed. We have a team currently of 2 people that will complete those evaluations. So Carrie and Melissa may be on that evaluation team, and I can kind of let you guys talk a little bit about what that looks like, if you want.
Well, the evaluation process, it does take 2 of us to do that. We have the therapist who concentrates on asking the questions in the Patel Developmental Inventory and listening to the parent responses and observing the child. And for the EIS on the other side, we're taking care of that paperwork and taking notes on parent responses and making sure that we reiterate parent concerns and making sure that we are addressing what they're concerned about so that we can develop their plans surrounding the delays or concerns that come up and also what the parents are truly wanting the support with. So
Right.
can I clarify that in any other way?
Well, and I think Melissa too, like with our evaluations, one thing that has changed is that like we as therapists have to kind of step back and give the control to the parent because we're not there with our toolkit and our bag and all of our stuff. And so we're also having to be a lot more creative. Like, okay, we need to see if they can stack. You don't have blocks. Okay, great. Do you have Tupperware? Do you have cups? What do you have? And then, you know, there's some areas where the kids just won't perform. So then we have to like look at it and see, do we give the parent the benefit of the doubt? If they say yes, 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 they can do it. Does that match up with every other area of the test? So, you know, it looks different, but, you know, with sessions, parents are a lot more involved now. And I think that's probably the biggest plus with being virtual right now, because before we would walk in a home and the parents would kind of step back, take their break. They would just kind of be bystanders, and now they are involved. And I don't know about other therapists or other programs, but I'm actually seeing more progress at this point because the parents are involved and they almost have the confidence level now to do what we've been recommending them to do this whole time. So that's my little spiel. I want to be back out. Like I want to be back out in the home, but
I definitely think the coaching model is really being implemented because of us doing the virtual, because, you know, the parents do have to be so involved. So I definitely agree with that.
All right. Let's see here. In terms of kind of your direct interaction, whether via telehealth or in person with families from both ECI and pediatrics, what are the biggest needs that you're hearing from families right now? Generally, specifically, if you can think of one particular family that you think is a good kind of example of what's going on in the community, but what are you hearing from families right now?
In general, and it may just not apply to young children, I think mental health services are the biggest need right now.
I think, the families are really, like you said, like, Dr. Harrison said, that, the mental health, but it's that social, emotional, that social connection that the kids and the families both are missing, so, yeah, I have talked to several families that they're just like, I just want things to go back to normal, and I think, too, developmentally, for kids, that social contact, because, some, the other little kids, they're learning from, their peers. And if they don't have that, if they're not in a daycare, if they're home with mom all the time, they're missing that, the connection with them. So I hear that a lot.
And their moms are stressed, and their parents are stressed, and they have no outlets, and yeah.
All right. If kind of thinking into the future, if we could, actually, let me regroup. In terms of accessing services and those issues around equity and who is coming to the pediatrician's office, who is seeking out services from ECI, when we start to look at data and disaggregate it and realize that we're probably missing folks in the community. I know this is, Tanaya is in the position that she's in now because the folks at Bluebonnet Trails have identified the fact that there's a population of kiddos who are being underserved in Caldwell County, and they're really eager to ensure that those kiddos have access to services. What is being done to ensure all families have access to these services? And if there is something being done already, can we do more of it? Can we kind of scale it up and get support from some of our community partners? It's a big question, y'all, I know.
I mean, just, for us right now, we are, again, I think I spoke to you guys earlier, about it, just trying to make connections with people in the community. So we're not missing, that particular population. And then also, and educating them, not just the pediatricians, but the thing I mentioned earlier is that, maybe going to even connect with some of the churches, and telling them a little bit about our program. And then also, I have made connection with Black Mamas ATX, just to get information out there about them. Also, I think, WIC, I'm going to make more connection with WIC. And then I think I mentioned also earlier about getting on Zoom calls with different associations, in-home associations as well, going to, when we can, when things are a little bit more stable, going to some housing authorities and making some connection there as well. So that's kind of what, I've, have on my agenda to do.
Yeah, that's a long list, Tanaya. that's a lot of work. I know.
So I can speak a little bit to that
Yeah.
too, if you'd like.
Yeah, of course.
Of course, before COVID happened, right? We're always talking about pre-COVID now. And we really enjoyed going to all of these outreach events, right? On the weekend where these groups of people are going to, community clinics and accessing resources. And we have tables there and we can talk to those people, that's changed right now. So we're really trying to work to get our information out to, like, say if the food bank is doing a distribution, then we're giving them our pamphlets and information so that those are being put into those food bags that are going out to the community. And we're trying to figure out all of these opportunities that we can still get our information out there. And I know that Amber's connected with the food pantry there too in Hays County. And so they're having our information present as well. So that's something too, that if any of you on this call are familiar with that or are aware of any place, any person that we can connect with, that we can get our information out to, please reach out to us and let us know, because we're really seeking those opportunities to identify those families right now.
Does anyone get in touch with the pediatricians and the groups at Communicare or the Hays County Live Oak at the Hays County Health Department? Because I know they see kids or at least immunizations at those places.
Yeah, I've been in touch, at least with Communicare. I have been in touch with their referral coordinator there in Kyle, and I think she manages Kyle and Wimberley. And
Okay.
I've been in touch with her regularly since all of this started, and they're still sending us referrals on a regular basis as well.
And I don't, I was asked if I know any pediatricians in Lockhart, and I don't. So I don't know where children in Caldwell get their medical care for the most part.
Right.
So Dr. Harrison,
I see children. I have a lot of patients from Lockhart, but I don't know where the ones who don't have transportation to come into San Marcos go.
That was my question, because we have seen, like, we feel like there's not enough children getting services at an early age in Caldwell County. So as a school district, we're trying to think about where can we, speak out and give information. And I was even just now looking up pediatricians in Lockhart. No one is specialized as a pediatrician. Yeah. So when you said that, if they're not going to a pediatrician, they might not even be getting the tests that they need to be able to figure out if they have developmental issues. That made me wonder if maybe some of our population just goes when children are sick and not really going for well checks. Yeah. Or we have the caravan that goes out quite often to do like immunizations, but are they doing any kind of well check at that time? Probably not. So I think there's a real breakdown with just the capabilities within Lockhart and pediatrics in and of itself. So I don't know. I would love anyone's suggestion of how to this conference. And Holly, it looks like you're like ready to speak, so go.
So we do have some different physicians that a lot of our children that we get referrals from are seeing. A lot of them do go to the caravan. A lot of them go to Seton, into the clinic to see Dr. Benchacroon. There's also Lockhart Family Practice with Teresa Velasquez, who we get a lot of referrals from. There is a pediatrician here, Terry Ann Russell, but I've never received any referrals from her. So I don't know that she's seeing children that are the younger ages, or that she knows of the referral process. So that's one of the things that I've really been wanting to do, is to get out to the physicians' offices and make sure that they're aware of referral processes, because I think we are missing a lot of kiddos, especially the ones that only go to the caravan if they're sick, or the school says you need this immunization and they run there to get that immunization, but they're not going for their regular checks unless they have a referral from ECI or something.
I see that Michelle Harper just put something up about Carrie Stoffel at church, and I can certainly talk to her about getting referrals, because she does do the diaper bank there.
Right.
Here in San Marcos.
That is a good through connection for sure. especially with Carrie since she is a nurse.
Yeah.
So we had a question come through from our mental health and disabilities coordinator with Head Start, and how we can work together to help the social emotional needs of kiddos. Kind of what resources y'all might give, either in pediatrics or in ECI, to the families in regards to those social emotional needs.
Yeah, the question about referral, I mean, that's a problem for everyone about who to refer to for social. There's a lack of services there in general. And I think that's a good question for all of us.
Right.
May I say something?
Absolutely.
So as I'm listening to what some of the challenges are in the age groups from the stats that are not receiving assessments, perhaps maybe they're not going to their pediatrician visits. I just want to remind everybody too that all the home visiting programs, not Nurse Family Partnership, of course, which I represent, parents as teachers, these programs are, and there may be some others in the community, and we definitely focus on that that growth and development of the brain, because we start serving that client during pregnancy. And so the conversations starting early, it's starting during pregnancy and her health, and then goes on until the child's 2. And Pat, y'all go until they're age 4 or 5, right? So, and we're doing assessments. And so we certainly do identify often, not that a lot of the babies are having delays, but sometimes they are seeing their pediatrician. And like you said, Dr. Harris, perhaps they're not following the Texas Health Step guidance, but those delays or potential delays are not being caught. So of course we refer them to ECI and then back to their pediatrician. So there's a place to catch them. And also when you think about the clients who, so many of this community, and all the communities are dealing with mental health, the parents are, that's also affecting these babies. So, if moms and dads are not getting the mental health services they need, and I know that's pretty thin, but, we do have a wraparound service for clients that we serve at Any Baby Can with mental health counseling. And then also in our NFP program, we're really looking at that, assessing mom in reference to depression and anxiety and referring us appropriately and working with her and her counselor. So I just want to remind everyone, if you have a way to refer these pregnant moms or new moms to some of the home visiting programs, that might be a good way to capture. And just another plug for NFP, we're trying to expand to Caldwell. We're applying for some grant money, so hopefully we will. And so anyway.
Yeah. No, I think you're right. I think there's a lot. I think there are maybe some other places that we could be looking at to kind of establish that. Dr. Harrison, did you want to say something?
Yeah, I said thank you for that, because we do a depression screen on our new moms, and sometimes we get someone who's depressed and we really don't know what to do with that except say, well, maybe you need to talk to your OB about that. And I know oftentimes that just goes by the wayside. So thank you for that information. That's a good resource.
Yeah, our home visiting program also screens for depression. We ultimately have the same issue. Part of that is a systemic issue with pregnancy Medicaid in the state of Texas. It ends after 6 weeks. So if you're talking to mama and she's 8 weeks postpartum, she doesn't have healthcare coverage anymore, and accessing those services becomes really challenging because there's no health insurance to pay for it.
Yeah. And we screen up to 6 months, so 6 months postpartum. So yeah, and we don't really know what resources to use with that. So
yes,
I think you also had the added feature there that you mentioned. The pediatricians can screen, but so much of what we do, we see a snapshot when they're in the office for maybe 20 to 30 minutes at the most. and we're basing what we do on what we see in that brief period. And now it's a mask on our face, and it's really hard to interact with those kids.
Right.
We have to go on the parent's history. And so many times those parents are in denial about, especially when we're looking into features of autism, and we have to go on what they're telling us. And you don't know how many times doing this over the years that these people, they don't want to admit to what their children are doing. Even if when you confront them with it, no. So.
Yeah. There's a really interesting question that came through privately to me, but I'm finding it so interesting that I think I want to go ahead and share it with the group. So this is in regards to kind of maybe the long-term impacts of COVID, and that, you know, children have been out of childcare settings. There's been less socialization, especially if they don't have siblings, more screen time. Kind of what are we going to be looking at with some of these long-term impacts? Are they reversible ultimately? Or are we going to be looking at a lot of kiddos? I can speak to one thing that I was kind of learned about at a recent conference, which was like, there's a lot of infants who have been looking at the faces of caregivers with masks since they were born. You know, so much of what we share in terms of a human emotion is with the lower half of our face. And what's that going to mean, you know, for a lot of these kiddos that have just seeing this view of the human face. So that, I know that is an area that is currently under investigation by very, very smart people looking into what the long-term impact of that might be. But do y'all have anything to share about what those long-term implications might be?
I think like all of the things with COVID, we don't know what all the long-term consequences are going to be, but I think the emotional and developmental consequences are far beyond even the health consequences. I'm still amazed at when I see kids come in and I'm looking for those milestones of smiling and communication milestones. I'm amazed that kids are still smiling and laughing at me when they come in for those 4 and 6 month checkups. Even though I can't interact, they still coo and they still smile with a mask on. And I'm amazed that they're still doing that. It makes me happy. I'm smiling under my mask and I can't share it with me. And they'll still coo and communicate with me, even though I can't reciprocate.
Sure.
So it makes me happy, but I'm fearful. I am truly fearful that the only people they see outside their home have masks on their face.
Yeah.
Yeah. And I'm also amazed that, well, the American Academy of Pediatrics has changed their guidelines on screen time for kids under 2, because they realize that, you know, they're going to have more screen time. There's just no way out of it.
Yeah.
For all kids in general.
Yes. More screens for all kids, but especially for those kids in those early brain building years.
Yeah. And for the older kids, oh my gosh, their obesity and just over the summer, the weight, the kids I'm seeing for well checkups, their weight has just zoomed up. The majority.
Yeah.
They do nothing but sit at home, and the only exercise they get is with their thumbs.
Right.
Do you think that also may be because of they're emotionally eating and not realizing it?
Oh yeah, they sit at home and play games and on their computer and they eat. They're bored, so they eat.
Well, and a lot of the parks have been closed at one point. You know, the information getting out was keep your kids close. You know, stay away from everybody. So it became the quarantine 15 or the quarantine 25 or whatever, however much, you know, you've gained. So I get that, but you know, I did not think about our kids being affected just as well physically as I know adults have. When we came back, lots and lots, everybody was looking at everybody going, you too, you too, you too, you too. So yeah, you know, we were embarrassed until we realized that we had a new sorority. I had a question, if you don't mind. You guys have been talking about a lot of the things that you're trying to cover. I know, Ms. Martin, you had a long list. My question was, do you have the staffing to meet the needs that you guys are describing? Anybody can talk to that? I'm sorry, Alex, I had to jump in.
Oh, no, that's totally fine. I appreciate that question for sure. I think that's a legitimate question. I think that's also a question for Dr. Harrison. Do you feel like you have, between pediatricians and then like your front office staff and your nurses, and then for ECI, do you have sufficient outreach staff to be able to kind of do all of these things?
Yes,
referrals, et cetera, right?
So yeah, so we have actually at with Bluebonnet, we have 4 different people who do our referrals, who takes our referrals. We have one bilingual person, and then we have 3 other, our referral coordinators, and they do the evaluation. So we have like an evaluation team of people that we do that for that. And then as far as outreach, tackling outreach. So I just, I have developed what I call a screen team. So I have also a team of, some early intervention specialists and speech therapists and, motor therapists that's going to be on a team. And then we're going to pick, certain days that we do go out, and certain counties that we go out on to do screenings and stuff. So yes, we do have that covered, the staff covered for that. And to do the services, if we, evaluate the kids go to evaluation and we enroll them, we do have the staff to for that as well.
We have enough staff to do ECI referrals. It's hard for us to have enough staff to try to look for mental health services and to find all these other things, because honestly, our referral staff is the same ones who are doing insurance approvals and trying to get things passed through insurance. And, and it's gotten so hard to get insurance approvals and then rejections and another insurance approval. That takes our time to get that done. Even getting approvals for a medication. I mean, it's ridiculous. So
yeah,
that's life in medicine now.
Right. Yeah.
I can speak for Any Baby Can ECI too, that we are fortunate enough to have a dedicated people for outreach. Not all ECI programs are able to do that. And so that can be concerning in some areas, but we do. So I cover a large part of our service area, and Amber focuses on Hayes, which is really, really awesome that she has all of those direct relationships with all of you all. So, and we also encourage all of our team members to be ambassadors of ECI, and they are, so we are fortunate. There is a lot of work to do though, still, that we're trying to get out there right now. It's hard.
I think we're fortunate as well that we have administrators that, as far as delivering services, they try really hard. I mean, you can't always control caseloads if there's a large influx, but they try to keep people within caseloads and hiring staff when needed. So we definitely are lucky in that regard as well, that we have enough staff to cover any services that come our way.
Because side note, there is no waiting list in ECI.
Yeah.
We receive referrals, we serve those kiddos. So we don't have waiting lists.
Yeah, no.
That is good to know, because there are services that families are kind of desperate for, like child care subsidy, that have very lengthy waiting lists, and can, families could be waiting for months potentially, but that is definitely not true with ECI. I have a comment from Jennifer Vogel. I'm a little behind on my comments. We got to talking, and now there's a lot of chat, which is awesome, about young parents, teen parents in her case, really struggling with food stability, housing stability, and utilities, and that for them getting on a Zoom to connect with a therapist is not going to be a priority for them using the money they have to drive to the pediatrician's office for that well child check is not going to be a priority. And I mean, that's huge. It's something for all of us to kind of consider and think about. There's no answer per se, but just, that's big for so many of our families, especially right now. Let me see. So do providers tell their low income clients about, in this case, specifically Community Action Inc., utility assistance programs, rental assistance, like either, and I would love to hear from both ECI and from Pediatric, those referrals to some of these other sources of support for the family that are more in that case management realm. Is that happening? Is that piece happening?
Yes, that is definitely happening. All of our, Melissa, please go ahead. I see you unmuted.
So it is definitely happening. As a service coordinator, that is a huge part of our role. Not only are we managing services and getting children enrolled, but we are addressing the concerns that parents are raising with financial needs. So they are being referred out to agencies that can help them with rent or utilities. The concern sometimes comes from families that are referred to us, but they aren't necessarily enrolled, because that case management piece comes after enrollment. We will do our best when we have them, when we're with them, to provide resources in the community, but they do get a thorough review of case management needs when they're enrolled with us.
Yeah, that makes a lot of sense.
Can I just chime in and say, I'm glad that was my question. I'm really glad. But with the pandemic, there's a lot more funding available than there normally is. The city of San Marcos got a huge chunk of funding that they gave to Community Action to administer, that doesn't have the strict qualifications on income limits. So a lot more people can benefit from that than the regular program, because it's the money funneled through from the city of San Marcos. And then Community Action Inc. just was awarded a bunch of money for rental assistance, and we've been hammering on that because we know evictions are looming very quickly in the future, and we already have issues. So just wanted to throw that out there, that the income limitation is not an issue to get assistance with electric bills right now. They're going to have, soon, and the city will too, have, eviction, rental mortgage, kind of money that you can latch onto. So COVID is actually, giving us a little bit more resources right now than we normally have.
Yeah, that is a good point. Silver linings, right? That's what we're looking for, the silver linings. And so yes, there are more resources available for families who maybe have that slightly higher income that otherwise wouldn't have qualified in the past. So from on the ECI side, yes, there is case management, but the child has to be kind of eligible and the family has to be engaged with services to achieve it. How about for pediatrics, Dr. Harrison? Is there, are there referrals happening to some of those other resources through your offices, pediatricians or whatnot?
I wished I could say there was, but since we don't have a dedicated social worker or anybody that can do that, I would have to say no. I mean, we try to do what we can to refer those folks, but if they don't pursue it on their own, it's not for the most part.
Right, and it could potentially be a conversation that's had in clinic with the family, but then for the follow-up, that is also
that's right. That's right. Exactly right.
Right. Miss Gwen is asking if there is a link or a graphic for ECI that would share maybe some developmental milestones that she could add to her childcare, either like a poster or to their childcare website maybe. If y'all have something like that, if you want to just email it to me and I'll send it out to everybody, and everybody can have access to it. I will put a plug in, which I shared in the chat, the resource that's specific to WIC, but the Centers for Disease Control has a really comprehensive website and a ton of resources under their Learn the Signs Act Early programming. These are, you know, resources to integrate looking at developmental milestones in early care and education centers, in pediatrics. It is, I don't think I've seen anything on this website that costs money. You can download and use everything for free. Sometimes it takes a while to get to you if you want them to print it for you. I will warn you on that. But there's a ton of great stuff on here. So if you just Google CDC Learn the Signs Act Early, you'll find all kinds of stuff. And in fact, I'll put this one in the chat right
Alex, they also have milestones that I posted the link. They have PDF printable milestones by month.
Thank you, Nikki.
Alex, I also have a PDF of a brochure that does have some of the common developmental milestones at certain ages that they should be hitting. I have that in English and Spanish. I can email that to you after the meeting.
That would be perfect. Okay, and then there was a little bit of chat about resources like Aunt Bertha, which are websites that are set up for folks to have kind of all those different community resources listed. The issue that you typically run into with like a community resource list is the updating, right? So you might have like some really intrepid employee or social work intern or somebody come in and like make this great list, and then almost immediately it is outdated, right? Something changes, funding changes, organizations come and go, qualifications change, whatever, and it's out of date. So yeah, I think that's kind of an ongoing concern in the community. I'm also part of a homelessness coalition, and that's a big, you know, concern for those folks as well, is how do we get a good resource hub going for the community? So work in progress for sure.
Pathways.org also has a really good like milestone checklist, ability checklist, lots of great videos as well that I often give the families as well.
Pathways, awesome, thank you.
Pathways.
There's a question from Stacy with WIC about, I'm assuming this is for ECI. Explain the process for a client once a referral is made. Kind of what's the next step. Stacy, if you want to unmute yourself, I don't want to butcher your question. So yeah, I guess even, especially now in COVID.
Alex, she accidentally sent it to me, but she said she can't unmute.
Oh, too bad. Okay.
I can kind of answer generically.
Right.
I don't know if this is what she's referring to, but once somebody makes a referral to ECI, what we're going to do is, at least on our program, our scheduler is going to call that family. We have a dedicated scheduler. That's all she does, is schedule evaluations for our families. And she's going to call and set up that evaluation for the family. Right now, of course, she'll send them the Zoom link. She'll send them, you know, all the stuff for DocuSign. And then that evaluation happens, you know, usually within a couple of weeks of when they're scheduled. Of course, we have 45 days. Yeah, and then our therapists take it from there, and we do follow up with referral sources once they've made a referral to ECI. We're going to follow up with whoever made that referral and just let them know kind of however, you know, did the child qualify? Did the parent decline? Did they enroll? So our referral sources will know what happened after the referral is made.
That's awesome.
I hope that answers your question.
Yeah, I mean, that is like, when you're talking about kind of the gold standard of a referral process, closing the loop on the referral, knowing ultimately at the end of the day, like, I made that referral as a pediatrician, as, you know, as someone involved with this family, and the parent successfully enrolled and now that child is being served. Awesome. or that parent refused, or maybe the child didn't qualify. Let's regroup and find another resource in the community. Pregnant mom, let's go to NFP, let's go to parents as teachers, let's go somewhere else because this family still needs kind of that support. So yeah, that's awesome to hear that they kind of closed that loop. Di shared a resource in regards to childhood obesity in the chat. So that's there as well. I'll make sure that all these links that are being shared out, both by myself and others, I'll put them all into an email that I'll do as follow up. So you don't have to worry about trying to find them right now. Nurse Sandy had a question. I'm assuming this is for Dr. Harrison about the case managers that work with the Medicaid managed care programs, if they can be of, I'm assuming, I'm putting a lot of my own into these questions, so apologies. But I'm assuming to maybe help with that, some of that case management piece.
We have used those case managers before in certain instances, but not all the patients that need help are on Medicaid, on those Medicaid programs. So that only works with those certain specific patients. And unfortunately right now, a lot of the people that have financial needs may have insurance, but their parents have lost jobs and they have the insurance for a while, or they haven't met their deductible and they still have a huge deductible, or their specific plan does not cover what they need, particularly if it's a developmental problem. So there's other factors there.
Dr. Harrison, if you have families that are concerned about referring to ECI because they think they can't afford it, that's not generally a problem.
Yeah.
I mean, we don't refuse them if they can't afford to pay for services. We're going to take them no matter what. If insurance doesn't cover it, we're going to fall back on that sliding scale. Okay. So, just letting them know that shouldn't be a deterrent for them being referred that they can't, afford services.
I had a problem this week that was unique. I hadn't come across, and it was not a child that was in early child intervention. And they were on a Medicaid plan, and I finally got in touch after 2 years with the social worker that was involved with that program. I've had a hard time following through with any service, and it was a Spanish-speaking patient. And we finally came to the determination after I got in touch with the person that these people were here undocumented, and they were scared to take any of the services because they thought they were going to be deported. And it was very sad, but I think we finally got them the services they needed. But I think sometimes that's not what we realize that is the issue. Their services are there, they're just not taking advantage of them.
Right, and that is true. There was a lot of conversation, a lot of very loud conversation over the past couple of years about the public charge. And what that could mean for families, and is especially true when you're talking about what they call the mixed status families, where someone's undocumented, but some folks are American citizens. So a lot of times the kiddos, especially the young kiddos that we're serving, are citizens, but one or both of the parents are not. And then there was a lot of kind of information out there and some misinformation. In fact, we had a referral to our Parents as Teachers program here in Hays County from a family that moved to the area from elsewhere in the state of Texas, who had been told by an immigration attorney not to enroll in ECI. And by the time we showed up, we were close to 2 years old and not walking. And we were like, no, we need ECI yesterday. Like we need to do something about this now, because this is not okay. And had to do a lot of dispelling a lot of the myths and kind of supporting the family to move forward with it, because there was so much fear, so much understandable fear, and following up with that.
Alex, that we've done is partner with the Mexican consulate also, so that families are aware that, that we are a safe resource, because if they're accessing resources from the consulate, they view those as being safe. And so we really try to partner with them to push out our information too, because we need them to trust us, to come to us. We want to help them.
Absolutely. That is a very good point. Priscilla, who works with Texas Health Steps, has put her contact info. So if anybody is interested in getting in touch with her, all the contact info, you got her cell phone number, you got her email address. She wants y'all to reach out. All right. Let me see here. When you discover that parents are in need of mental health support, where are you sending them? I think ultimately we've all agreed we don't know, because there's not enough services in this community for especially uninsured adults. I will say that in the population we serve, probably a lot of overlap with ECI in particular. The majority of parents do not have health insurance in our program, and that is because they fall in between adult Medicaid, which you basically have to be homeless to qualify for. I mean, the income restrictions on that are really, really low, and the Affordable Care Act. You have to make a certain amount of money to qualify for plans on the Affordable Care Act exchange. And a lot of our families fall in between that. There was Medicaid expansion money that was provided to states that was supposed to help ensure that those families, those adults could get coverage, and the state of Texas refused that money.
Yeah.
So we don't have a lot of those adults then screening for depression.
Mm-hmm.
They don't have health insurance, and we're really limited. Care offers counseling on a sliding scale fee, but you're still talking about like 30 minutes for $45, which $45 is a lot of diapers. I mean, that's like, these are kind of decisions that a family is ultimately having to make then, is what are you going to spend that $45 on? And so, yeah, that's a really big concern to me. I've been working with a group out of Austin who specializes in postpartum healthcare, and they have a voucher program, and they are willing to serve families in Hays County. So I'm working with them on figuring out what referral systems we can potentially be setting up. So I'll share their information in the chat as well, and then in subsequent emails.
Is Shibe no longer doing sliding scale or any of that nature?
They are. They really tend to focus more on folks who are going to need medication management, and kind of that. And in so many cases, we're talking about, especially with the postpartum piece, is like, some talk therapy, maybe a group, something kind of more relatively short term, and not necessarily needing that long-term medication management from psychiatrists. And that's the population I feel like we're missing, is we don't really have great resources for that. So the kind of really extreme, like schizophrenia and some of these more extreme diagnoses that need medication management, those are getting addressed by our MHDD through Shibe, but then there's a lot of other needs that are going potentially unmet.
I know that, Sandra. Oh, go ahead. I'm sorry.
Oh, no. I was just going to say, I know that, with Bluebonnet Trails as well, we have, services, and counseling, for people with those needs. We're in Williamson, Burnett, Caldwell, Lee, and Bell counties. Those are some of the counties that we are, but it's who are, like our parent company. So that's, the Bluebonnet Trails is our parent company. So, but we do offer services, counseling, and also, people who may have like bipolar or schizophrenic or something like that as well. So. a sliding scale. They do have some on if they don't have insurance on a sliding scale.
But if they live in Hayes County, then it's a no-go.
They're the MHDD for Caldwell County as well. So
Okay.
we have a different MHDD that serves Hayes County. So yeah, that's why they have such comprehensive services under their umbrella, because they serve all those communities too.
This doesn't apply to early childhood or to adults, but we are fortunate in the state. The Texas legislature did pass some funding for primary care providers for psychiatric and mental health, so that if a primary care provider, such as a pediatrician or family practitioner, is dealing with a problem, because we've been forced into doing psychiatric care that we've never had to do before. For instance, depression and anxiety. And if we get to the point that we feel like it's above and beyond what we can handle, there is a 188 number that we can call. And within 30 minutes, we're supposed to get a response back from a psychiatrist or a mental health provider that can give us assistance on that case. And if needed, get that patient in touch with a psychiatrist in the area that can provide them services on a telemedicine basis. It's also supposed to bring fellowships to promote people to come here for training so that they'll stay in Texas, and we'll have more providers.
I attended the Pediatric Brain Health Summit last week, and the woman who helped set up that legislation spoke at this summit, and she was talking about the average age of your adolescent and child psychiatrist is definitely on the older end, and retire, and we are going to have a big lack of.
Well, Texas is already one of the states in the country that's already in a deep shortage. I've already used the service twice, and I only signed up for it 2 weeks ago. So yeah, it's wonderful.
That's awesome. I'm glad to hear that it exists and it's working.
Yes, it is.
Ultimately getting the help that you need. Wow, this conversation has been great, you guys. Good job, everybody. All the question askers and answerers. I am super excited about it. It is 2:45, so we've got about 15 minutes. I would love to, if there are any final questions that anybody wants to put into the chat, we've got a few minutes to do that. And then I would love to hear kind of a wrap up from our panelists. If there's anything else that you want to share, anything at all, we'll just take a few more minutes and y'all can kind of have the floor. I know you guys don't want to hear me talk for the next 15 minutes, so somebody.
Waiting to see if anyone had any questions.
There haven't been any more in the chat.
Okay. So I would just say for ECI, when in doubt with a kiddo from 0 to 3, refer. When in doubt, refer to us. We are going to figure it out on our end and help that family navigate their current situation. So just when in doubt, refer. If you have any questions or you would like for us to come and speak to your team, contact us. We are so happy to do that. We would love to do that. If you have any general questions at any time, please call us. We are here to help you. We're here to help our families, and we just really want to support those little ones. Yeah.
And I think once we get into a space post-COVID, where things are kind of safe again, where all of our ECI providers are back off of work from home and telehealth, and our childcare centers are kind of open to having folks come in again, that I would love to talk about how we can kind of support bringing in screening to those childcares, and see if there's money that we can bring in to help make that happen, or what that could potentially look like, because I think it's a great benefit to the community for sure. Oh, we have a question. Can ECI help direct a family with a child who is over the age of 3, and if so, how? What does that look like on y'all's end?
So are we, if we receive a referral for an older kiddo, I guess we can kind of answer these different scenarios. So if we receive a referral for a kiddo who is over 3, we're going to help connect that family to their local school district to kind of make sure that they get evaluated on that end to see if they qualify for special education services. I often get inquiries through my email from various people who have questions about how to support some kiddos that are over 3. And so in those cases, I'm happy to tell them about our, our other home visiting programs that we have available, or the school district, or just kind of help answer those general questions. So we get those often, but yeah. But again, when in doubt, we're here to help.
I'm going to do the little shameless self-promotion here real quick. Let me pull something up that I've kind of been working on to be able to share as a means to that end, exactly what you're talking about, Di. This infographic that I would want to share kind of across systems so that families can kind of be equipped with as much information so that they can kind of go out and find the right provider potentially. Sorry, it's all taking a second, y'all. Okay, so let me get this open and share it with y'all. Okay, so we start off with, are you concerned about your child's development? And then we get into kind of information for parents, encouraging them in their role as the expert on their own child. I mean, they really are. They know their child way better than I will ever know them. Pediatrician, ECI provider, even the best one, you cannot be an expert on that individual child. Only that parent is. So kind of looking at that, understanding all the different domains of child development, knowing what we mean when we say language development and cognitive development, ensuring that we're talking to the pediatrician, right? Knowing what services are available and what they do. I think that's big. Occupational therapy doesn't tell me what it does. I wouldn't know that if I didn't work in this field, right? Sensory processing and small muscle development. That's a much more kind of succinct way to talk about it. And then I have the contact information. We start with ECI, then we have contact information for early childhood special education, which used to be called PPCD, but they changed the name. So now it's early childhood special education, contact numbers for the school districts that we partner with, Hayes, San Marcos, and Lockhart. And then, also we have pediatric home health and therapy providers that might be able to bill Medicaid, CHIP, or private insurance for services. I'm not going to list all of them out because there's too many between the 2 counties. So it's just kind of a caveat. And then I also have this in Spanish. So my thought was that this would be a resource that could potentially be available in kind of they call them rack cards. It's like a brochure, but it's just kind of a one front and back English, Spanish that could be available at a childcare facility, at the doctor's office, at WIC, where families could be potentially seeing the same exact thing in multiple different spaces, which is always, from a branding perspective, a good thing when they're seeing the same thing in lots of different spaces. So that's kind of something that's in the works from the perspective of the Start Smart Collaborative.
Love it.
Love it. Love it.
Thanks, you guys. It was really fun to make, and I super love it. So yeah, I think kind of the next step for me is just like getting these printed out and shared out with the community. So I was looking forward to this meeting today to kind of share it with everybody. And so everybody could see it, and I'm getting really positive feedback now. So I think we will make that happen for our community. So yeah. All right, y'all. We are about 5 minutes out from the end of this meeting. Does anybody have any last comments or thoughts or anything else that they want to share? We're getting a lot. Panelists, y'all rocked it. We were getting a ton of great feedback from all of the attendees about this discussion today. So thank you so much for spending a couple of hours with us this afternoon. I really, really appreciate it. Really cannot overstate how great this has been. Yeah, we did it. Good job, everybody.
Thank you, Alex, for all your work and for getting this organized for everyone.
Literally the only thing that would make this better is if we were all in a room together.
Totally.
And I got to hug people, and I got to feed you lunch, because I also always loved to provide lunch at coalition meetings to folks. This is great. I think our participation and attendance is actually sometimes better via Zoom, because folks can kind of multitask and attend. And so that's cool, but I do miss all of you lovely people and seeing you face to face. So yeah, I've been recording the bulk of this. I forgot to record my part. And then I started recording right when the panel started. So we got all this good stuff recorded. I'll post that to our Start Smart website and share that link with y'all. Everything that was shared in the chat, I'll make sure to download to and get all of those URLs into one place so that we have access to everything that was discussed today. If there's any follow-up questions for ECI, for either Hayes or Caldwell, or even for Dr. Harrison, email me and I can get y'all in touch with them. And yeah, thank you so much for coming. I appreciate you all. Stay in touch. We'll have another coalition meeting probably in January. Probably won't do one in December. December's a little bonkers for everybody. And so I will, if I don't see you before January, I will see you in January for sure for another coalition meeting. But I'm here, email, cell phone, text, Facebook. Bye, everybody.
Bye, thank you.
Thank you.